Acetylcholine is the chief neurotransmitter of the parasympathetic nervous system, the part of the autonomic nervous system, which is a branch of the peripheral nervous system that controls smooth muscles, dilates blood vessels, increases bodily secretions, and slows heart rate. The acetylcholine receptor is an essential link between the brain and the muscles, so it's a sensitive location for attack. Many organisms make poisons that block the acetylcholine receptor, causing paralysis. Some of the symptoms of an acetylcholine deficiency: constipation, gastroparesis, memory problems, difficulty with word recall when speaking, learning difficulties, dry mouth, dry eyes, orthostatic hypotension, low muscle tone, depressed mood, fast heart rate, chronic inflammation, and emotional instability. Excessive accumulation of acetylcholine at the neuromuscular junction and the synapses causes symptoms of both muscarinic and nicotinic toxicity. This can include cramps, increased salivation, lacrimation, muscle weakness, paralysis, muscular fasciculation, diarrhea, and blurry vision. Imbalances in acetylcholine are linked with chronic conditions like Alzheimer's disease and Parkinson's. Over 50 years ago, clinical studies suggested that increases in central acetylcholine could lead to a depressed mood. Evidence has continued to accumulate, suggesting that cholinergic system has an important role in mood regulation. Acetylcholine normally enhances cortical sensitivity to external stimuli, and it decreases cortico-cortical communication, increasing focused attention. However, increases in acetylcholine signaling can lead to symptoms that are related to anxiety and depression. For example, while stress-induced acetylcholine release can result in positive adaptive responses to environmental stimuli, chronic elevations in the cholinergic signaling may produce negative maladaptive behaviors. This indicates how, like other neurotransmitters and functions in the body, balance is key. Prevailing hypotheses of the pathophysiology underlying schizophrenia have largely focused on monoamine like dopamine and serotonin. However, there's an increasing amount of evidence from clinical and preclinical studies that aberrant acetylcholine signaling may also contribute to the disease. Epidemiological studies have long shown that schizophrenics exhibit high rates of tobacco smoking. This suggests that the patients may use the nicotine, which is an agonist of the N-acetylcholine receptor, for self-medication. Check out my other video on schizophrenia for more information about balancing neurotransmitter production to help this condition. Acetylcholine plays an important role in cognitive function, as shown by pharmacological manipulations that impact working memory, attention, episodic memory, and spatial memory. Acetylcholine also shows striking modulatory influences on the cellular physiology of the hippocampal and the cortical neurons. You can check out my video on nootropics and on choline sources for ways to help to improve your focus, memory, and other cognitive faculties through supplementation. My video on brain-boosting herbs also has some natural ways to enhance acetylcholine levels. Evidence exists for both cholinergic and glutaminergic involvement in the etiology of Alzheimer's disease. Acetylcholine, the neurotransmitter essential for processing memory and learning, is decreased in both concentration and function in patients with Alzheimer's disease. You could check out my video on Alzheimer's disease for more related information. Acetylcholine, which is known to influence behavior related to novelty seeking and exploration through its actions in various cortical and subcortical brain areas, is likely to have a role in mediating the changes in emotional behaviors that are induced by high-fat dietary consumption. Clinical reports suggest a positive association between fat consumption and the incidence of hyperactivity, impulsivity, and cognitive abnormalities. Binging on fat is also found to predispose animals to increased cocaine seeking and risk-taking behavior, suggesting that this diet may generally enhance risk-taking behaviours, whereas the ability of dietary fat to produce behaviours related to emotion, impulse control and cognition is becoming more generally recognised. Choline is an essential nutrient and a building block of acetylcholine. Foods that are naturally high in choline include whole eggs, meat and fish, and whole grains. Studies in lab animals and humans suggest that consuming foods or supplements that are rich in choline may elevate levels of acetylcholine in the brain. However, for people who consume nootropics to enhance choline in the brain, it's suggested that 4 eggs per day should be consumed to provide enough choline. This can be difficult for many people, and they prefer to supplement with CDP choline or alpha GPC. Centrophenoxine increases acetylcholine levels in the brain, and many report an increase in verbal fluency with doses of 1 to 2 grams per day. It's an enhanced version of the supplement DMAE, or dimethyl aminoethanol. This may help to reduce age spots on the skin and also aging in the brain. However, it appears to increase acetylcholine in the brain by robbing it from the muscles. This could explain the toxic symptoms to a baby when DMAE is taken during pregnancy. Therefore, if one is considering to use this for social anxiety, it would be advised to limit its use and to supplement with other choline sources when you're not taking it so that your muscles don't become deficient in choline. The neurotransmitter acetylcholine is involved in tuning growth hormone secretion, and its growth hormone stimulatory action has mainly been shown in adults, but it's not clearly documented during development. Increasing growth hormone may have anti-aging benefits, and it may speed up the repair of injuries. See my other video on life extension with growth hormone, DHEA and berberine. Exactly how vitamin D functions to preserve cognitive function is unclear. It may increase acetylcholine, the brain chemical and the neurotransmitter that's important for memory and other brain functions, and it's found in low levels in many patients with dementia. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with D3. Vitamin B1 thiamine is required for acetylcholine production. Sulbuthiamine is a synthetic form of B1 that easily crosses the blood-brain barrier. People take sulbuthiamine by mouth for Alzheimer's disease, weakness, athletic performance, depression, diabetic nerve damage, erectile dysfunction, fatigue, and memory enhancement. Bacopa miniari is a nootropic herb. It has the lowest chance of creating side effects over other forms of cholinesterase inhibitors. Emerging research demonstrates several mechanisms of action: the acetylcholinesterase inhibition, choline acetyltransferase activation, beta-amyloid brain plaque reduction, increased cerebral blood flow, and monoamine potentiation. Guatecola is another nootropic herb with research supporting its efficacy and few reported side effects. Several mechanisms of action from the Guatecola were demonstrated for enhancing cognitive function, such as the inhibition of acetylcholinesterase activity, the reduction of phospholipase A2 activity, the protection against the beta-amyloid plaque formation, and protection from brain damage. Huperzine A is extracted from a fir moss. It's been used for various diseases in traditional Chinese medicine, for fever and inflammation. It has potent cholinesterase enzyme inhibition, while it has also been shown to be effective to improve memory due to mechanisms other than just the cholinesterase inhibition. Again, like serotonin and dopamine, a leaky gut or absorption problems can lead to nutrient deficiencies, which require higher than normal doses of supplements to correct them. Digestion and nutrient assimilation can be enhanced by fixing a leaky gut, for example by taking enzymatically preserved colostrum and taking the amino acid L-glutamine. Also, the elimination of common allergens from the diet, which may be causing inflammation, oxidation and autoimmune conditions like gluten or high sugar consumption. Another type of absorption condition could be an MTHFR gene polymorphism, requiring higher levels of B vitamins to be consumed in order to prevent the damaging effects of homocysteine from occurring. It's been shown that increased homocysteine levels impair reference memory, and they reduce cortical levels of acetylcholine in a mouse model of vascular cognitive impairment. Many different nootropics work on acetylcholine, either by increasing levels of this neurotransmitter or by increasing receptor sites for more acetylcholine to bind to. There's a whole topic about the many different effects that can be had from the various acetylcholine-based nootropics. For example, oxiracetam is considered to promote work, whereas aniracetam is considered to be the best to improve creativity and social skills. Piracetam is considered to repair brain damage and have a subtle general brain boosting ability. Other racetams are said to improve interest in what would normally be considered to be a boring activity such as study, and others to improve the ability to hold and to juggle numerous pieces of information in the brain at once. One could spend years slowly determining the best dose of each racetam for a desired effect, and they could have a whole cupboard of different racetams for different days, depending upon the activity that's expected of them that day. While this may seem like a form of over-medication and an unnecessary crutch, and even an addiction, many biohackers who've been taking racetams for many years say how it has massively improved their quality of their life and their performance without producing any negative side effects. They claim it's permanently increased their IQ even after they stopped taking these racetams. Mood, immune and cognitive benefits of probiotics have been demonstrated, and a balanced microbiome appears to be essential to health. A new field of interest here could be psychobiotics, which are an emerging class of probiotics of relevance to psychiatry. Such mind-altering probiotics may act via their ability to produce various biologically active compounds, such as peptides and mediators normally associated with mammalian neurotransmission. Several molecules with neuroactive functions such as GABA, serotonin, catecholamines and acetylcholine have been reported to be microbially derived, many of which have been isolated from bacteria within the human gut. Secreted neurotransmitters from bacteria in the intestinal lumen may induce epithelial cells to release molecules that in turn modulate neural signaling within the enteric nervous system and consequently signal brain function and behavior of the host. Consequently, neurochemical containing and producing probiotic bacteria may be viewed as a delivery vehicle for neuroactive compounds, and as such, probiotic bacteria may possibly have the potential as a therapeutic strategy in the prevention and/or the treatment of certain neurological and neurophysiological conditions. For more information about the herbs or supplements mentioned here, go to my website.